Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families in the Berkshires and also beyond in the Hampden and Hampshire counties, all in the comfort of your own home. And in healthcare, it's very important to have partners who you can work with throughout the continuum of care. And it's also important that those partners have the same type of clinical reputation and excellence that you do. And so that's why I'm very happy to welcome to the program the administrator for Mount Carmel Care Center, who is David Laplante. And Mount Carmel just differentiated itself, having its third consecutive deficiency-free survey, which is something to be celebrated. So, David, welcome to the program. It's great to have you.
Thank you, John. Thanks for having me.
It's great, and of course, you're based in Lenox. As people know, you're on right on Route 7, across from Devonshire Estates, and it's formerly Providence Care Center.
That's true, John. About a year ago, actually it was October 1st, there was a transition and a change of ownership that took place. The Sisters of Providence Health System transitioned the ownership of the facility over to the Carmelite Sisters for the Aged and Infirm. And it was really the culmination of a long process in terms of transition and due diligence and looking at it. And that's, fortunately for me, how I happened to arrive on the scene. And just a great transition and a clear change of ownership to yet another skilled nursing facility in the community.
And it's interesting because the way that it was dubbed was like you said, a passing of the torch, because it was from one Catholic organization, being the Sisters of Providence, over to the Carmelite Sisters. So that the mission itself for the building really there wasn't that much of a change.
Well, that's true, John. Actually, we worked very hard to make the transition as seamless as possible, and one of the real cornerstones of that transition was the fact that we were transitioning from one faith-based organization to another. That was important to the Sisters of Providence Health Care System, and to the staff. It was important to the staff, and as well as the community, because I think it certainly is an important niche that we provide in the community. And so the transition again was a smooth one. There were other interested parties in terms of the acquisition of the facility, but it became very clear very early on that the Carmelite Sisters was the right one.
Right, and to the credit of the Sisters of Providence, right? I mean, that having that sort of consistency, I'm sure, was important for that organization as
Absolutely.
well.
I mean, the acquisition, even prior to the acquisition, in terms of the transition, right at the top of the list was that we would try and do everything we could to find a faith-based organization to transition, so that the continuity of care for the residents and patients who were there was maintained, as well as being able to continue having a faith-based organization in Berkshire County.
So let's talk about what people know as a nursing home, what it is today, and perhaps how it has evolved. Because to me, and being in the industry for a little while, it seems like it has transitioned, at least over the last decade or so, that nursing home or nursing facility, long-term care facility today looks a lot different than it did maybe a decade ago, or certainly 2 decades ago. So tell me about that.
Absolutely, John. The evolution or the change really started back in the mid-'80s when hospitals, the reimbursement to hospitals changed, and it had a tremendous impact on the nursing facilities, the long-term care centers that supported the communities around these hospitals. And it really, the short version is that the reimbursement for hospitals changed. It became much more driven by diagnosis, which then became a partnered around length of stay. So patients, if you've been in the hospital recently, you certainly recognize that patients are not forced out, but there's an incentive to move the patients along to another appropriate level of care. And so the skilled nursing facilities, or the transitional care centers, or nursing facilities, that was kind of the catalyst for all this change. So as a result, the nursing home of the past, where where it was strictly a long-term care facility, where folks came who needed clinical care on a daily basis, 24 hours a day, could no longer live at home. started to change to a short-term model, at least for part of the organization, in terms of having patients come from the hospital to the center or the facility that had no intention of spending the rest of their life there, and in fact were looking to get home to their own environment, their own independent style of living, and so on. So it's become very much a business that has a couple of different types of customers, and I guess the easier part in terms of looking at it is the traditional long-term care resident, which is still very much a part of our organization and very, very important in the community, as well as a growing group of short-term rehabilitation, kind of short-term patients that come from hospital settings that come to us only for a finite period of time and then leave us to go home.
And so with that, it means that the diversity of care, it seems to me, has changed. One from, again, perhaps where it's a lot of certified nursing assistants, and then registered nurses now, occupational therapists, physical therapists, speech therapists. That kind of group has become a big part of things as well.
Absolutely, John. The makeup of the staff has changed significantly, and it's really driven by the fact that many patients, residents, whichever they are, who come to us, for the most part in general, are of higher acuity. They're sicker. They're coming to us later in life. Those who do choose to come to Mount Carmel Care Center, coming to spend basically the rest of their life, they're waiting as long as possible. They're being supported by home care agencies or family members, and so that's a trend in itself. And so those folks are arriving later in life with more medical compromised issues that they have, as well as this other whole group of patients who come from the hospitals primarily, who are here for a short period of time and have just had some sort of acute intervention at the hospital, whether it be surgery or stroke or heart attack, need to come to us for a period of time to get their strength back, to learn those things that they need to relearn before they can go home. So as a result, the composition of the nursing department has changed such that your certified nursing assistants become more trained in different areas. The nurses themselves are dealing with more complex clinical issues. And then there's the other whole piece of the rehabilitation service, which includes speech therapy, occupational therapy, and physical therapy, which is just now a very integral part of the operation and going forward. And I see that trend is going to continue.
So I see, looking at that, when you have these major changes, it also means that the way that nursing facilities are being rated probably has changed. I mean, the kind of level of work that goes into surveying these things has probably changed pretty significantly over that time period as well. So maybe we can talk about that a little bit, because at the top of the show, I mentioned that Mount Carmel Care Center, over the last 3 years, previously Providence Care, has had 3 consecutive deficiency-free surveys from the Massachusetts Department of Public Health, which is really significant in the industry. So maybe you can talk about that a little bit. What is that process like when the state and the surveyors actually come in and then they ultimately give you a sort of grade?
Sure. All skilled nursing facilities are required to undergo an annual survey process. Now, these survey sessions are unannounced. A team of surveyors will come to the facility, and their primary purpose for being there is to take a look at the quality of care that's being provided, make sure that all the supports are there that any patient and or resident needs are there on a consistent basis, and that they're there in a high quality fashion. So this is a process, as you mentioned, that we at Mount Carmel Care Center, prior being Sisters of Providence Care Center in Lenox, this is our 3rd year as a deficiency-free facility. There's a tremendous amount of work that goes into that, and it's not like it's an event that you prepare for. I mean, this needs to be the day-to-day care that you provide these patients.
Part of your culture.
And residents. It's part of the culture. It's part of who we are. It's part of what we are evolving into and have evolved to as a function of the changes in healthcare overall.
And that's very interesting because, you know, in being in the industry for a while, you know, you hear about things that become what they call tags. So the surveyors go through and say, well, you know, they see something and it's a certain tag. Some are worse than others. But to have these people who are very focused, looking for things, and then for 3 consecutive years not to have any of these so-called deficiencies, it's a rare accomplishment.
It is, and you know, it's a tremendous tribute to the staff at the facility. They do a tremendous job there. But you're right, John. There is a whole book of opportunities for deficient practice, I guess the state surveyors refer to as, in terms of things that we could do differently or should do differently. And those are the things that they look at when they come. The difference at Mount Carmel Care Center is that not only do we have systems in place that provide that day-to-day, high-quality, consistent quality of care, you know, you can't do it without a good quality staff. And we've got a tremendous group of employees there at Mount Carmel Care Center. And that goes a long way. I mean, there are a lot of skilled nursing facilities in the region, throughout the country, you know, and there are big places, small places, there are old ones and brand new ones. Mount Carmel Care Center, the facility itself has been there for a number of years. It's a bit smaller, it's a little bit more intimate than some of the larger ones, and that I think is an asset for us. It lets us provide a little bit more intimate care, makes an opportunity for the staff to get to know that resident or get to know that patient even better than perhaps in a larger facility. So, but aside from the bricks and mortar, again, the real difference is with the staff.
It is. It's so important, and that level of care is really what it all comes down to. In healthcare, we talk about outcomes all the time,
Sure.
And like you said, you know, no matter if you have a large building or a small building, new or old, in the end, it's about how the patient or resident, how that outcome is, and the quality of that that really matters. And of course, the level of you know, relationship that you have with the family, because that's important too. Now more than ever, customer service is something that more healthcare organizations are focusing on, because there, I think, is a recognition that for a long time healthcare hasn't been exactly the bastion of great customer service.
Right.
But you've performed very well on that level too, because you've measured that.
Yes, we have. John, you know, there's a couple things that go hand in hand. It is, again, how the staff interact with those patients and residents every day. And we do measure that in a very quantitative way. The Mount Carmel Care Center has also had the opportunity to be recognized by a national organization of resident and patient satisfaction. It's called Innerview. For 3 years in a row, we have won the Service Excellence Award, which is, now this is a national organization that's involved in skilled nursing facilities all over the country. So, and that's a designation that we take pride in. It's important to us, and you know, we live in a very computer-savvy environment these days, and information is available, and it's important. There's a lot of information that's on the internet about skilled nursing facilities, both for that patient in the hospital who's thinking about, well, where do I go for a month or two for my post-hospital care, or that family member, as you mentioned, that's looking for somebody to put mom and dad and to have a relationship with the staff where that they know it's safe and that the quality of care is superb. So the information is out there. It takes a lot of education. It's a real process about you know, selecting a nursing facility, both whether you're coming just for a little while or for a long period of time. I mean, it's complex.
So tell me a little bit about your own evolution. You've been in senior care for some time. So, you know, tell me about that a little bit. I know that you were at Sweetbrook for some time when it was clearly one of the preferred facilities. You did a tremendous job there for some years. But you've been in this business for a little while, so you know you know your way around it.
I have, John. I guess without dating myself, I've been in healthcare forever. I wouldn't know how to do anything else. I started my career in the hospital side, and I mean, very early on in high school, I washed test tubes in a hospital laboratory. That was my first introduction to healthcare, and then from there, continued to move in the hospital setting. You know, went to college and got a bachelor's degree from the University of Vermont, and then later got a master's degree in business administration, and continually along the way worked myself to a senior level position, administrator, and moved out actually into long-term care. I did that early on in the 90s. I had an opportunity to work in the state of New Hampshire. My very first experience with long-term care was really overseeing 5 long-term care facilities for the state of New Hampshire for the mentally retarded. And that was a very unique experience, but it was my entree there. However, when I was in the hospital business, one of the things we did at one of the hospitals where I was the administrator was to develop a geriatric-focused program specific for those patients, residents, who were very difficult to manage in the nursing homes. I mean, this is long before the advent of Alzheimer's centers in different skilled nursing facilities. So we had a program there where we took folks in from, this happened to be in the Boston area, so these were coming from other hospitals. They were falling through the cracks, unfortunately, and what we did there was to put together a multidisciplinary team, much like what you see today in the skilled nursing facilities, to care for this group of patients and folks, elders. So that was when I got a real introduction to elder care, and you know, I love working with older people. I think it's fascinating. You know, some of the stories that they have are great, and I really enjoy it. So I'd made that transition, and I've been in senior care, as you mentioned, for a number of years, and I'm very happy to be there.
And your approach, you know, seems to be, you know, when you talk to David Laplante, he seems to be more of a sort of laid-back guy. You know, that, you know, you see a lot of people who are, you know, executive directors or administrators or whatever, who, you know, who may be more aggressive. But you have you know, your personality. You know, tell me about, you know, your leadership style a little bit, because, you know, you've been very successful in what you do, and I'm sure there are probably other people in healthcare probably who look at you and say, well, how, you know, what are the things that you look for in hiring great directors of nursing, or, you know, different managers and so forth, and then, you know, leading that. You know, I know it's a big question. We could write a book about it, but, you know, but tell me about that a little bit. Your leadership style.
Well, you know, we've at Mount Carmel Care Center, we've got a great management team, and you know, as I look around that room or that table every morning, I look to those folks to be really an extension of me. And in terms of my own management style, I don't want to have anybody be treated any differently than I would like to be treated myself. And I often remind staff of that, and I am managers and supervisors of that. And because I think that's so important, that you have to be able to develop a relationship and a connection. You know, that's not to say that sometimes, you know, there are rules, and sometimes you have to, you know, maybe you may walk quietly, but you carry a little bigger stick. But you know, I've been very fortunate and very blessed that certainly over the years I've made many mistakes. There's no question about that. But it's given me an opportunity to kind of sit back and reflect on leadership in a way that I think provides an opportunity to get the most out of your staff, and that's really what you want to do. You want them to flourish, to do well, to feel that they've been empowered, to not be so worried about making mistakes. We all make mistakes, but we want to learn from them. So I think those are kind of the cornerstones of how I try to work on a daily basis.
And as healthcare continues to change, I'm sure, you know, you have the finger on the pulse, you know, seeing where it's going. You know, what are your thoughts about the future of, well, you know, senior care, but overall healthcare? You know, things like healthcare reform making a big impact, continuing challenges as far as the reimbursements for, you know, certain services. I don't know if things will be changing at any time soon, but your thoughts on that, and how it's making the world shift a little bit.
Well, we're in the process of tremendous change. We have been for a period of time, but you know, certainly it's no mystery that the federal government has gone through all sorts of changes in terms of how health care is to be provided and how that changes the industry. It is changing very rapidly. The whole relationship between being a provider facility like ours and the payers, the ones who actually pay your bills. And for a skilled nursing facility like Mount Carmel Care Center, it's primarily Medicare and Medicaid. Those are the primary largest payers, then with some commercial insurance, HMOs, and some private pay as well. So the real drivers, and I think it's true in all aspects of healthcare, obviously, the federal government and how that's working. One thing is for sure, the healthcare dollar is shrinking. The piece of the pie for healthcare reimbursement is being divided up, and it's not getting any bigger. So you have to be creative at a facility level, at a center level, operationally, to make sure that, you know, with fewer dollars, you are continuing to provide all of those things that you've been providing over the years. It's a challenging time, and certainly. I don't have a crystal ball, so I'm not sure how it's going to look, but I can say that I'd be willing to bet it's certainly going to look different again from what it is today.
And it's interesting because, you know, it makes you feel good about being a part of a nonprofit. You know, Mount Carmel Care Center is a nonprofit. You know, you used to hear stories about a lot of the for-profits with their stockholders and that sort of thing, especially when the reimbursements were much greater. As far as that goes, that, you know, people were making a real lot of money at nursing facilities, and of course we want to make sure that people are getting paid properly and that sort of thing. Sure. But there may have been, especially maybe in the 80s, some rather extravagance going on in that world.
Sure, you know, that's true, John. You know, again, I've been fortunate. I've had an opportunity to work in the nonprofit environment as well as in the proprietary environment. And they are different, and I think the driving force that makes them so different is in the proprietary setting, you have either stockholders or somebody who has a vested interest in that operation. Well, that's not to say the nonprofit that is absent, because it is Sure. not. Right. I mean, we have a board of governors, we have a senior organization that's very much interested in making sure we continue to be viable. However, again, there are not shareholders to answer to. These are, for the most part, volunteer boards and members of, in the case of Mount Carmel Care Center, the sisters themselves who are involved in continuing the mission. I mean, the Carmelite Sisters' mission is for providing care to the aged and infirm, and it's all over. I mean, the Carmelite Sisters have facilities scattered throughout the United States and Ireland as well. Yeah. You know, I need to take a trip, I think, to one of those, but take a look. But it's certainly noteworthy that these facilities continue to flourish and do well because of that mission and that core.
Yeah, that is so very, very important. And in the conversations that we've had, it is very true that that, you know, being consistent, and again, you know, making sure that the building also is accessible to everyone, and that's important too, because we talk about things like Medicaid that actually is a lower reimbursement, you know, compared to other reimbursements for services. That's something that does not phase this organization.
Well, we've been able to strike a balance. You're correct, John, in that Medicare is a payer that does not, in a general sense, pay as well as the others. Now, that doesn't mean the care is any different. We are required, and that's one of the things that under the survey process, they look for, you know, the standard of care. If for facilities that are Joint Commission accredited, there is this one standard of care, and that's true for all facilities, regardless of their accreditation and their reimbursement. So, you know, it doesn't matter whether the payer is a Medicare, Medicaid, or private pay. You know, it goes back to that care, the level of care, and the consistent quality.
And as we have about a minute left, David, I want to thank you for coming on the program. How can people learn more about Mount Carmel Care Center? And I'm sure you encourage individuals to take tours of the building.
Absolutely. We encourage people to stop by, come by anytime. There's always somebody available to give you a tour. As John said earlier, we're right there in Lenox, right on the main road, so you can't miss us. We also invite you to give us a call, come and meet with us. I think that's the most important thing for families in particular, and potential patients and residents around selecting a skilled nursing facility or a transitional care center, whatever the case may be. So there are all sorts of ways to access us. We'd love to have you. I think it's important. That's probably one of the most important things in terms of making that decision as to where you come. Come visit. Come see what it feels like. Come see what it looks like, and watch the staff interact with the patients and residents there.
So wonderful. David Laplante, a great pleasure having you on the program. We really covered a lot of territory.
Thank you, John. Yes, we did.
On this show, so thank you very much.
Thank you.
And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.